guys, Dr. Christy Ennis, physical therapist, certified strength and conditioning specialist, and nutritionist. And today I want to go over some ACL treatment options for you. ACL is a ligament in your knee, and it's a ligament that is commonly torn in athletes and actually non-athletes too. Now, sometimes you do need surgery, but sometimes you do not need surgery, especially if it's a partial tear. You always want to discuss this with the orthopedic surgeon to know what the best plan for you is. But even if you do end up needing surgery on that knee, the surgeons really like you to have as much range of motion and strength as possible. So these exercises will apply whether you're getting surgery or whether you're not getting surgery, okay? Step one before you get to any exercise, though, is really if you've got swelling and a lot of pain, you just did this, you really want to ice it, and believe it or not, yes, rest it a little bit. Sometimes they'll put you in what's called an immobilizer brace so that you're not moving a lot except when you go to do your exercises. Again, make sure you talk to your physician about that aspect of things, but ice is always going to be a good bet right off the bat. So number one set of exercises is all going to be dealing with range of motion, meaning bending and flexing that knee, okay? Again, you want to have as much motion as you can possibly get just for healing or if you need surgery too. Please let pain be a guide here, okay? So you're not cranking on things, you're going gentle. So number one, we're going to pretend it's my left leg. You can just prop this up on a pillow a little bit. You can keep a little bend into that knee. I'll back up a tiny bit here. I've got my foam roller, so that's what I'm using. And you're literally just going to do some ankle pumps, right? Back and forth. You can do this even lying down all the way. You don't have to be sitting up like I am. Back and forth this way. You can even make an alphabet to make it much more exciting. But that's going to get some blood flow going, okay? Number dos. I am going to lie back down for this one. You can keep the opposite leg bent up. And you're literally going to slide that heel out. And then you're going to come back up as high as you can, again, without a lot of pain and discomfort, okay? So as you go about doing these, you may find that you are able to get a little bit more range of motion by the time you get to the end of your set of exercises, okay? That is that. The next one is literally letting your leg hang. Now, be careful with this. You don't want to let it do this because the ACL is working to prevent doing that. So if it's torn, it's going to be easier to kind of go, lock a little bit. But if your knee is stuck up like this, we want to try to get it straight a little bit. So trying to let it come down a little. If you need to have a little support, you can too, because we really want to work on getting that straight, okay? That is that one. You can, if you're beyond that heel slide, if you go onto your belly, as long as that's okay, you can work on getting some knee flexion this way too, which will be a little bit harder, obviously, than doing that slide with the heel. But you need to make sure this is comfortable for you as well. And then lastly, for the motion, you're going to get a band and you're going to attach it to something relatively sturdy. This is not the most sturdy, so I'm not going to pull real hard here, but it's going to go behind the knee, but just a little bit above that knee space there. You are going to bend to 30 to 45 degrees approximately. You don't have to measure it. And I know I'm bending over a little because I'm trying to hold this chair. You want to try to be straight up. And then you're going to pull back against that band. So that, again, is working on the straightening part of that knee, okay? And you want to focus on whichever one is the most limited if you're low on time. But recommendation for this is 2 sets of 10 to 20 repetitions, actually 3 to 5 times a day. So a fair amount you want to work on this. All right, moving on to strength. Again, we want to work on getting this quad nice and strong. So if you start, again, if your leg's a little bent up, that's okay. But you want to think about squeeze into this muscle and press that knee down, right? That's going to activate this quad muscle here. So it's literally just squeezing, pretty easy. I'm going to grab my ball. You do not have to have a pretty pink blow-up ball like this, although they do sell them for like 99 cents at some of the grocery stores. But you can easily just use a pillow if you need to or want to. If this position is comfortable, you're going to sit up with those knees bent, and you're literally just squeezing into that ball. That's like the thigh master here. If that's not comfortable, you go straight, right? Especially if you need to work on straightening that knee a little, you can think about squeeze into that quad and then straighten. And again, if that also is uncomfortable, feel free to do either of those positions lying down, okay? From there, Again, we're going to use our little foam roller. I'm going to place that bolster right underneath my leg, squeezing into this muscle again, and then I'm going to work on lifting that lower part, okay? This gives your knee a little bit of support while working on strengthening that quad. The progression from that, I'm going to lie back down, squeeze into that quad again, and then you're going to lift that leg up without tilting or rocking anywhere else. However, if you cannot do this and keep the quad tight, you really shouldn't do this even if it feels okay. So if you go to squeeze the quad muscle and go to lift and then your knee does this, you're not ready for this exercise, okay? Just keep that in mind, like I said, even if it actually feels okay. We're going to go for the outer and the inner thigh. To get the inner thigh, we're going to cross that opposite leg over, and you're just going to lift. Again, it's almost like you're posing, right, for your modeling shoot here. To get the outer thigh, you'll roll onto the other side, and my back is going to be towards you. Make sure you're trying to line up everything nice and straight, and then it's a lift here. If you need to, you can put a pillow in between your knees if that's causing any pressure or discomfort in through that knee, okay? And then one more, again, only if it feels okay, and you can hang on a little bit. I'm not going to, but you can. It's just a little bit of a partial squat, okay? Again, you have to have enough stability that you feel confident in your leg to be able to do this. Another reason why it's good to kind of hold on a little bit. So there you have it. Those are the strength ones to start with. Now, you only want to do one set of those versus the range of motion, right, which were 2 sets, 3 to 5 times a day. This is one set, 1 to 2 times a day. So a little less aggressive than some of those range of motion ones. So there you have it, a whole whopping set of exercises to work on that knee ligament. So thank you for tuning in. If you haven't subscribed yet, please do so and stay tuned for more.